Fast, patient-first healthcare is the critical priority for everyone in New Brunswick's healthcare system. But despite considerable progress and record investments, patients are still waiting too long for care. So why is that? And what is your New Brunswick government going to do about it? It comes down to one word and our focus: speed, all while improving patient care. Several years ago, our province experienced a financial crisis. The headlines read New Brunswick was on the brink of collapse. Our economy was among the worst performing in Canada. Young people and workers left in droves for opportunities elsewhere. Tax revenues dried up, and even with strong ambitions from health leaders, poor fiscal management meant there was no money for health investment. Our system was set back by a decade. Thankfully, we have seen a complete turnaround. Young people are coming back home, and our median age has gotten younger. New Brunswick has even paid off $2 billion in debt. That's allowed the province to increase health investments by 38% since 2018, meaning more than $1 billion more per year, much of which has gone to hiring more healthcare professionals. But despite funding being available for new positions, much like other provinces, we can't find enough people to fill the jobs. And the record population growth that we're seeing has imposed more demands on our hospitals. To top it off, the pandemic led to staff shortages and burnout at levels never seen before. So we've had to get innovative to address staffing shortages. How, you ask? First, we've doubled the number of nursing students from 888 to 1,689. This means more opportunities for New Brunswickers to train and work here at home. Second, we've established an innovative 3-year nursing program at UNBSJ that shaves a year off training time so we can get nurses working faster. Third, we've increased first-year medical school seats to train more doctors to a record 74. 4, we're aggressively recruiting internationally for nurses and healthcare aides. The result? 129 net new doctors since 2018 and more than 1,000 net new licensed practical nurses and registered nurses in the regional health authorities. More staff, shorter wait times. But more staff is only part of the solution. We need to be smart with how these professionals connect with patients. That's where innovation comes in. That's why we've launched the NB Health Link, which has already connected more than 58,000 patients to primary care providers. That's decreased the wait list for New Brunswickers who wouldn't otherwise have a primary care provider like a doctor or nurse practitioner by 78%. And we've made healthcare appointments more accessible, having funded more than 425,000 online visits so far through eVisit NB. We're also expanding the My Health NB app so patients can see their test results and medical imaging wait times, and we will be working to add emergency department wait times. We've also looked at the roles of our healthcare professionals and found ways to broaden their work and increase efficiency. Paramedics on a scene can now determine whether or not a patient faces an emergency that requires immediate transportation to hospital by ambulance. And pharmacists can now treat 12 or more ailments like eczema or pink eye. As healthcare becomes increasingly complex, we also need greater collaboration. That's why we're supporting efforts to open up more collaborative healthcare clinics and teams across the province. These clinics include professionals of various disciplines to better help patients and speed up care, especially for those with complex or chronic conditions. While collaborative clinics are important, so are specialized clinics for surgery. We've opened 3 clinics for cataract surgeries, moving the procedures away from the hospitals, and have more to come. To date, the first 3 locations have completed more than 6,000 procedures. Through smart investment and focus, we've also reduced wait times for knee or hip surgeries by more than half. Real solutions and real progress. Our government also recognizes that mental health and addictions play a significant role in the efforts to improve access to healthcare for all New Brunswickers, which is why we introduced one-at-a-time therapy walk-in clinics at all addiction and mental health centers across the province. This is giving walk-in clients same-day access. It is also providing those who want an appointment with one within 7 days. And we introduced the New Brunswick Addiction and Mental Health Helpline. We also launched Bridge the Gap, a new website that can help New Brunswickers during times of stress and uncertainty. That's not all. We increased treatment beds at addiction services centers in Camelton and St. John, and launched a 5-year pilot project, Planet Youth New Brunswick, to help communities find ways to reduce substance use among youth at 4 sites across the province. This is part of an integrative health approach. There is still more work to be done as our country and province face healthcare challenges due to unprecedented staffing shortages, an aging population, and backlogs from the COVID-19 pandemic. There is no one easy solution, but through smart investments in new staff, innovation, collaboration, and specialized clinics, we will continue increasing the speed of care and put patients first. Your government has a clear vision and is moving with ever-increasing speed to build a stronger health system for all New Brunswickers.